Okay, we are live. We can start.
Good afternoon. My name is Dr. Eden, and I will be the moderator for today's session. So I'd like to very warmly welcome all our viewers to today's Physio TV session, which is titled Errors and Biases in Research Methodology. So as soon as we think of the word research, we think of a very creative, a very systematic process of collecting data, analyzing it, organizing the information that we have. And all of this is directed towards one primary purpose, which is to advance human knowledge, our understanding of a certain topic or a certain issue. And even though there are many approaches that we might take to research, it is always with this primary purpose of advancing knowledge that we undertake these endeavors. And when we think about research methodology, we start looking at these various approaches of the outline, the strategy that we have to undertake a particular kind of research. What are the modes of data collection? What do we expect to do with the results that we generate? And while we outline everything, we always have in mind that this advancement of knowledge that we want to take forward is of the highest quality. So to have this highest quality of research, we always look at how we can minimize the errors, how we can be aware of the biases that might creep into our study. And to help us further navigate this topic, to understand more about errors and biases and how we can steer clear from them, I'd like to welcome today's speaker, Dr. Summaiya Shaikh, who will help us navigate this topic. So a brief introduction: she is a physiotherapist and academician who is a PhD scholar and associate professor at the SIA College of Health Sciences in Dombivli. She's a verified Scopus, PubMed, and Web of Science reviewer. And she's also certified in a 6-month hands-on course on the SPSF software. So I think it is very, very gracious of her to have taken out time today to be with us and share her guidance on this topic. And without any further delay, I'd like to hand over to ma'am, who can guide us ahead.
Thank you, Eden. Thank you for the wonderful introduction and for giving me a kickstart. So I would like to just start my presentation. Eden very well summarized it for me. The importance of, at every stage, where do errors and biases come into picture? So, yes. In our research world, the stakeholders, that is the authors, the readers, and the reviewers, they are the ones responsible for maintaining communication. And this communication we maintain or we promote this communication via scientific writing. We publish papers, and the stakeholders, as I said before, all these stakeholders have more or less equal responsibility of maintaining the dignity, the principles on which research was founded. And there are two basic principles. The two basic principles are transparency and accuracy. So, it is very easy to say that research should be transparent and accurate, and it should be this and that and X, Y, Z and whatnot. But what do you exactly mean by being transparent and accuracy? So I'd like to give you an example. Also, in the initial responsibility lies on the authors. Initial and the main responsibilities on the authors. But to ensure that the authors have published or stated facts which are transparent and accurate, the reviewers have they have a different job where they are going to scrutinize the manuscript or these facts from top to bottom, and then they will present it to the readers. The readers encompass the authors, reviewers, and other stakeholders also. So it is an umbrella term. And how can the readers contribute to this communication via scientific writing is when the readers review an article. The readers can also review an article after it is being published. So it's called as a post-publication review, where if the readers find a flaw in the methodology, they can simply write back to the journal, stating in the form of a letter to the editor, stating these are the strong points of this article and these are the weaker points of the article. That is why we feel that maybe the impact or is not robust enough, indirectly meaning that the methodology was not transparent enough and thereby less accurate. So basically, as Eden said, that how you conduct, how you catch, and basically how you report finally. They are three different things, but under the same term of methodology. So I can hypothesize accordingly, but it can happen that intentionally or unintentionally I report something else, which is not suiting to the original hypothesis or objective which I had thought of initially. So what happens is when you collect data, you go through your data and you see that, okay, not all values look similar. Not all values are in the center. You have certain outliers, they are spread out. So what you do is you go to a statistician. What we do is go to a statistician and the statistician is going to ask us three questions. First is, how did you calculate your sample size? The second question will be, what's your objective or hypothesis? And the third is, which variables or factors did you take into consideration? So it happens that we usually, we have already taken these three questions into consideration while designing the methodology. And sometimes it happens that we haven't. We have only considered one aspect of this, and that is the sample size calculation. That to someone else has done and given it to you. Okay, and then you start with data collection, but all this should be done when you are designing methodology. So because later on when you are when you are going to the statistician with all your data and you tell the statistician, after asking you these three questions, is going to report your analyze your data and give it back to you for you to report, you significant. So that is a very big thing in our community, that the p-value should come significant. It is very overhyped. So you tend to cover up. This is called as think I have lost connection.
Yes.
So you want me to continue from?
Yes, please. I think we were able to hear you right till where you were cut off.
Okay.
Just carry on from there.
Okay. All right. Yes, so I was saying that, so yeah, we start fishing for the p-value. This is not right. And reviewers can very easily pick up this cover up. Okay. Everyone has done their job, but when you start putting them together, whatever you feel right, that, okay, I want my p-value significant. This is just one of the reasons, of biases. You have done it correctly, but you have deviated from the actual the truth that you wanted to present. And this is the main reason for rejection, because reviewers, they sit with a guideline or a checklist with them, so that they scrutinize every aspect of your methodology. Okay, hence it is a very wise decision to introduce the statistician in the beginning of your methodology, and not when you are about to calculate your sample size, or just go and when you are starting with data analysis. So it becomes imperative if you introduce the statistician in the beginning, because the statistician is going to help you in designing, is going to suggest. The final decision lies with the researcher, of course, the author, but the statistician is going to suggest you outliers, is going to suggest you extraneous variables which can affect your independent and dependent variable, and there itself, you have minimized the bias. So this is the objective, all in all, of my presentation today, to introduce you to guidelines for designing the observational studies. What are errors and biases, and the types of biases? So you can say, usually we do a lot of observational cross-sectional case control studies. There are other types of study designs also, but since we are very much more familiar with observational, I chose observational for today's presentation. So all what we're going to talk about is observational study designs. So these are four checklists or guidelines or prerequisites which are used for designing an observational study design methodology. We have PEDRO, our favorite, Robbins I, and the NIH2. So let us see STROBE. Now, if you see here, STROBE says that they are guidelines for publishing observational studies. Does not mean that when you sit to write your manuscript or when you're about to publish, you use these guidelines. Obviously, you will use it at that time, but it is a 22 item checklist. There are only 21 given. The 22 item was on the next page. It couldn't come in my screenshot. So there are 22 items. Okay. And before you send for publication, you are actually going to cross-check, re-verify whether all these 1 to 22 items were present or not in your study, or did you take them into consideration. So my point is, why to wait for you to start writing the manuscript and then refer STROBE guidelines? Refer the STROBE guidelines when you are designing your methodology. So maybe not all components will come into picture, but I think 1 to 13 or 1 to 12, at least these components, till the methodology part can be taken into consideration, because that I have an observational cross-sectional study design, and the reviewer, obviously you will aim to publish, is going to cross-check my study design using a guideline meant for the same. So why not use it beforehand? And these STROBE guidelines, which mean, or the full form is strengthening of the reporting of observational studies in epidemiology. So you cannot use this for a randomized control trial. You cannot use this for analyzing or doing critical analysis for a systematic review. The study design is completely different. Okay, so you're going to use it only for your observational studies, and it allows authors, editors, reviewers, and readers to critically appraise the study. I think the study was done in 2019. Yes, very recent one. PEDRO, though I would say we are all very familiar with PEDRO, and you just have, it's 11 item checklist, and you just have to answer in yes and no. Very simple, but the disadvantage, or not the disadvantage, I would say the limitation of PEDRO is that it will critically appraise, or it was meant to critically appraise only physiotherapy studies. So yeah, I think there are questions. Yeah, question number 6. There was blinding of all therapists who administered the therapy. So therapist and therapy. So you can apply this only on studies which are done by physiotherapists, conducted by physiotherapists, and they report therapy. So that is the limitation of this observational study, this checklist. But it is a very good scale, and it was definitely funded by the Sydney University and the Australian Physiotherapy Association. And they also have a reviewer course, online reviewer course. It's obviously paid, and when you do that, you become friends of PEDRO. That is a term used for that. Okay, you get that term. So if you see no, yes. So if it is no, you tick mark no. But if it is yes, where? Where means actually there is one more thing over here, that is line numbering. So you know, in your manuscript, when you go to your Word document, you can number the lines. So where did you find the eligibility criteria was specified? Write the line number here, 23 maybe. Okay, so that is how it is. And mind you, Stroke, Pedro, Robbins, they all have excellent and high reliability and validity. Robbins eye, this is a very extensive tool for measuring, for identifying and measuring bias. Whereas if you see in Pedro and Stroke, there is no word, there is only one word. Only once bias has been mentioned here. This is all the methodology. Whereas in Pedro, I don't think so there is bias mentioned anywhere. But in Robbins is made for assessing bias. Okay, 2016, it was published in the BMJ. And the full form of Robbins is risk of bias in non-randomized studies. Non-randomized studies are studies which are not randomized. So obviously the ones which are randomized controlled trials. There you can't use Robbins. So observational studies come under non-randomized study intervention. So the wonderful part about Robbins I stands for intervention, and there is one more Robbins E, which is in process. It has not yet been published. It stands for Robbins Exposure Studies. Anyways, I was saying the good part or the best part about Robbins is it is going to identify the source of biases. Where exactly is this bias coming from? And how much is the risk? It is going to quantify the risk, meaning identifying the source of biases means there are 7 domains throughout the intervention, pre, at, post. But the checklist is a 34-item checklist. So there are many signaling questions and many subgroupings and subheadings within these 7 domains. So it becomes very specific, very extensive and cumbersome and obviously time consuming. And you need a specialized amount of training to operate Robbins eye, but it is not impossible. So yes, it is going to calculate the risk of bias and tell you whether this study has a low risk of bias, a moderate risk of bias, high risk of bias, serious or critical risk of bias. So once when I understand that this study has a serious risk of bias, I am not going to look at the results, because I know that the results are not going to be accurate enough. And this is what I mean, that if you have a robust study design, bias is going to be inversely proportional to it. The bias automatically gets reduced if you follow all these checklist items while preparing your methodology, rather than referring it to later. Okay, and I think Strobe is the best, which fulfills all our criteria within our constraint and other limitations. It is one of the best guidelines we can have. And if you are, ever in doubt, what does study size mean? You just read the explanation, which is recommendation, which is given to you, and you just have to mark yes or no. That's it. So PEDRO is 11 item, and stroke become and Robbins is 34. So somewhere in the middle, which covers almost all aspects, is the stroke guideline with 22 checklists. So I think it's a good effort if we make it in the beginning. All right. Okay. So these biases, they can be introduced intentionally. That is, if the researcher is allowing the entry of biases. Okay. Or it can be introduced unintentionally. So it's like a very small thing that I thought of. Galti karna or hona, like mistakes can happen, or you do mistakes, you tend to do mistakes. So, but it is a galti after all. So bias will enter, what I want to say is bias will enter your study by hook or by crook. But how do you minimize it? How do you keep it to bare minimum is the test of the researcher. Okay, and all those contributors who are involved in that study, in fact. Okay, and but agar aap hi galat ho, then there is an error. So this is the main difference between error and bias. Okay, this is what I have understood. So a small review on errors. So I'm not going to go into details of what is type 1 error and what is type 2 error, but giving you a very practical example. Like you have a scene before you where there is a fire in a building, and there are two possibilities. You either evacuate the building. So you are the decision maker. Maybe the decision is on you now. You have two possibilities as the decision maker. That is, you either evacuate this building or you don't evacuate. Okay. Now, if you evacuate, like for example, I've mentioned the causes, probably it could be a small short circuit. Okay. And if you evacuate the building, people will say, oh, it was just a small short circuit and so much inconvenience was caused to us during evacuation. The panic, the anxiety, the elderly people, they have to move out and all that. I mean, that this is all a big inconvenience. So definitely there was an error on the part of the decision maker. We understand. But when you talk about not evacuating, if you decide not to evacuate, and if the fire has spread tremendously, you have caused inconvenience already. But if you do not evacuate, the risk of getting trapped in the building with fire is directly death. Okay, so you're actually risking your life. So in both the possibilities, inconvenience is common. It is there. But the risk is more common or more evitable in the second situation where you chose not to evacuate. Okay, this risk, this situation, this possibility is the type 2 error. So type 2 errors are always dangerous. They are always, inconvenient, of course, but they are risky. And both these possibilities were chosen by the decision maker, and that is you. So now you decide, it is on the researcher which way, this way or that way. Do you want to introduce type 1 in your study or type 2? Error is inevitable. Bias is inevitable. What you choose and what you allow is your choice. Okay. So all these things should be reported clearly in the manuscript. We often think, we refer to our mother articles, parent articles from high-end journals. By saying high-end journals, I mean PubMed, Web of Science, and Scopus Index journals. These journals, when you read the articles, they have a sample size of 10, 18. 19, 38. This is their sample size. You have followed their methodology up to the T, and you have created your own innovation and scientific knowledge, all that apart. But why don't our publications, our research get published in those high-end journals? I mean, the rate is very less. Why? Is because we do not talk about bias and error. And I'm going to show you examples how extensively they talk about, how confidently and proudly they talk about errors and biases. Okay, and that is what makes them different from us. So bias is when you deviate from truth. And these deviations can occur during data collection, analysis, interpretation, reporting. But if you are introducing bias, or if bias is introduced, if you're allowing, or if it is coming unintentionally, whatever is the cause, it is misleading, unethical, and immoral if you haven't checked for biases in your own study. So it is every researcher's responsibility to be aware of all the potential sources of bias while designing your methodology, and not after you have completed data collection. Then it is of no use, because however beautifully you have written your manuscript, the best statistical test you have applied, okay, the statistician has applied the best statistic, but if you are not able to report it properly, and if the methodology is flawed, full of biases and errors, the reviewer is not going to go to read your introduction and your conclusion and your discussion. Not interested. Okay. So the problem with us is the methodology is too concise, too precise, too specific. It should be elaborate, because the future researcher, when they will read, the readers, when they read your facts, that okay, given these pre-specified eligibility criteria and condition, and with these situations, how did you go through data collection? What were the problems you faced? What were the study limitations you had? So then I, as a reader, can learn, and I know what not to do and what to do. And I will frame a better methodology. This is how research is going to grow. Okay, so being aware is one thing. And what action you have taken, how did you solve, what efforts did you make to minimize this deviation from the truth? We want to read as readers and reviewers in your manuscript, and that is completely missing. So the potential sources of bias arise when you abuse data, when you torture data, as I told you about phishing. These are few examples. It happens. I mean, we do this. I have done this. Just because I saw someone else's study, as a student, when I saw someone else's study coming significant, the p-value is significant and mine is not. And the atmosphere around is such that the p-value should come significant. It should be less than 0.05. That term that is become so overhyped, and we are so dependent, our entire thesis, methodology, everything is dependent on the p-value, that we start looking where will we find the significant p-value, and we choose that. Okay, we avoid, and that is not correct. That is not correct. We avoid reporting. One more thing about phishing is, using the appropriate statistical test. The most important thing when you apply a statistical data test to your studies is you look for normality. Is the data normally distributed or not? If it is normally distributed, you are very happy, you're going to apply PEDRO test and all the parametric tests. But when it is not normally distributed, you apply other tests. So that does not mean that non-parametric tests are bad, or they shouldn't be applied, or they will, make your results less accurate. In fact, they're going to state your results as it is. So even if your data is not normally distributed, it is okay. It is very, very okay, because Using the appropriate statistical non-parametrical test, you are going to calculate error, the range of error. You're going to identify your outliers. You are going to identify the problems, okay, which this particular, or you're going to actually identify the factors, risk factors, if you apply the proper statistical test, depending on your normality. Okay, so that is very much related to p-fishing. So if I get a significant p-value in parametric, I will write I used parametric test. No, you can't do that. Okay, but mind you, the reviewers can very easily pick this up, and I will show you how. We feel that we should not report our limitations, our weakness. It's like खुद के पैर पे कुल्हाड़ी मारना. Okay, so this is not so. I just told you why you need your limitations and why they should be elaborate and extensive, just like your discussion, so that someone else can refer to this. And even if they have low sample size, they have the methodology is flawless, and the discussion on limitations and the potential causes, the sources of bias, they have, that is also they have described it so wonderfully that there are no there are no two opinions you can have about it. And the other thing is, how was the recruitment of patient done? So were the patients enrolled? So just because you feel that 20 to 30 age group is a healthy population, as a researcher, you will recruit them in your this group of healthy individuals. And if you have a control group and symptomatic and asymptomatic group, just because you want healthy population and you think that 20 to 30 age group is a healthy population, you take them. But you don't see whether they are students or not, because student group is a vulnerable group, right? And whether they were randomized or not, how did you enroll them? Did you enroll them by word of mouth? Did you put posters? How did you enroll the participants? That you have to mention clear cut in your methodology, because Strobe is going to mark you on this point. Now this example 55 by 156 I have mentioned over there means what I want to say is, just because my sample size came to be 30, I went to the statistician, my sample size came to be 55, for example. So I will write 55 participants were recruited from this university in the age group of 20 to 30 years. Means whoever I got, I took. This is a non-parametric type of sampling method. So if it is so, you write it. But if it is not, the ideal way to write it is that you screened them first. You screened the number, maybe 156. Okay, you screened them first. You recruit first. You announce that you're going to start the study, and then you started screening. And when you got a number of 156, you applied the eligibility criteria on them, inclusion criteria and your exclusion criteria. So they're going to fill your data recording sheet in actual sense. They are going to fill it, and then you will see, okay, this person is not eligible for my study. Sometimes you have a participant bias where the participant says that I find your study very interesting, what you're doing, and I want to be part of it. Yeah, you can be a part of it, but if my eligibility criteria is not applicable in you, inclusion and exclusion, I cannot take you in my study. So out of 156, I screened them for eligibility criteria, and then I narrowed down to 55, which is my sample size. This is just an example, a number which I'm giving you. And this is how you mention your whole recruitment and enrollment process. Then that sounds sensible. Okay, so the data which I've got from this is moving more towards accuracy. Okay, it might be accurate. You can assume that very confidently. The next is dropouts. Dropouts is out of, for example, these 55 participants, which were your sample size of a particular group. Even if it is a one-time study, or an intervention study, there must have been dropouts. And it is very much possible to have dropouts. I mean, due to whatever reasons you have. So what happens is, even if we have dropouts, we don't mention, but we take 55 only. Okay. Or it is now what happens is, when what I want to say by saying adjusted with sample sizes, usually when the statistician is going to give you the sample size calculation as 55, a good statistician will estimate the sample size by adjusting it. That is, the sample size must have come to 45. But after you adjust a 10% plus minus DF value, what is called as, or the precision value, you will add 10 extra 10 maybe. The statistician will add 10 to the extra 45, and that is how it will come 55. So a good statistician is going to give you an adjusted sample size, so that even if you have dropouts, the data will remain accurate when you interpret it. So a statistician most of the times has already given you an adjusted sample size, but you don't want to report dropouts because you don't know that the statistician has already adjusted the sample size. So this is called as balancing or foreseeing the dropout rate, and the 10% dropout rate is okay. It is allowed even if you report it in your manuscript. 55 10% is 5, so even if you have 5 dropouts, it is okay. 5 to 6 dropouts are fine. Okay, so report it. The next is data inadequacy. Sometimes what happens is, I have very nicely taken all my data, and I realized that when measuring, I made some mistake, with these 2-3 samples, and I know it. Sometimes my data is lost. I don't find it. Sometimes the quality of the data is very poor. That is what I mean to say, or my measurements were not appropriate, or up to the mark. What should I do in this case is, I should report it and I should exclude that part. So how did you handle missing data is a question in strobe guidelines. Did the authors mention how was missing data handled? Because it is obvious nobody in the whole world is going to get a 55 on 55 sample size. Just the patient is just going to walk in, and you're going to carry out your research very wonderfully and report it. It is not possible. Okay. So the question is inevitable. How did you handle the missing data? Missing data, reasons of missing data are dropouts and data inadequacy both. And obviously the screening part also. That is why you also nowadays, you have journals, this positive sweet talking that we do, that all our results are positive, all our results are significant. So the people are tired of hearing all these things, because there is no going further. It's a dead end when you reach there. That is why there are certain journals. This is just one journal that I've mentioned here, Journal of Negative Reporting in Biomedicine. So all your negative reports, all your non-significant, statistics, all these studies which you have actually done very properly with a flawless methodology, they are saying that you come and publish in this Journal of Negative Reporting in Biomedicine. And obviously, I mean, it is obvious that these reports are going to be accurate because they are transparent, they are clear cut in front of your eyes. So all in all, I want to say is just report it. Report all sources of bias and errors also. Now, these are certain examples, okay, the studies which I came across. Look, 38 healthy participants in the age group of 18 years were recruited into the study. If you can look here, see, into the study by means of advertisement posted on university and community notice board. It is clear cut they have done this. But if you don't mention this, 38 healthy participants over the age group of 18 years were recruited into the study. That's it. Now, this sounds very fishy to the reviewer who's reading this. Only the thing is, I mean, you have to do it to add the line. I'm not saying just add the line, but you have to actually do it. And it's very simple. That is how you get a very mixed variety of people coming in and approaching you rather than you approaching them as a researcher. So these 38 healthy participants, if you see, their demographic details were taken, and what they did is 38 they divided into 18 plus 16. Okay, 18 and 16, and they applied a test, t-test, for two groups, males and females. You can't do that. If you are reporting your sample size is 38, and if you want to keep two groups, each group should have 38 participants, and you can't make your own subgroup. Okay, so this is not how it is done. So now the results, this p-value, which I'm going to take non-significant or significant, one knee range of motion has come significant, 0.05. I cannot take this p-value because you are saying 38, but you're analyzing, subgroup of it, a subset of it, and reporting the same also. That males are, it is knee range of motion is better in, or BMI is better in males and females, or whatever it is. Okay, so this is not allowed. If you see here, this is a very good study published in Radiology Journal actually. See how they have, distinctively mentioned the dropouts. Only 6 subjects were excluded from the study. I don't remember the sample size now. Owing to edema of venous insufficiency, 2 were excluded. 2 had type 1 diabetes mellitus, and 2 had femoral and tibial fracture history. So 6 subjects were excluded. Very good, very nice. Okay, so this is how you report it, simple. Now look at the limitations. This is just like another discussion. 1, 2, 3, 4 paragraphs. This title is only study considerations and limitations. And I think if you have seen, their limitations also have references. So they're saying that this person found an error of 1.2 mm, and we found an error of so and so. And every point, if you go to read, is described wonderfully. This is how limitations should be described. So I, as a reader, will know, okay, this can become the need of my study if I don't do this and if I do this. Okay, so it's very nicely, and that is how, with a very less sample size also, these studies are published because they are transparent. They are going to give you a take-home message. Look at the results. They are different studies, they're not same studies. They are how nicely, clearly, they have mentioned the difference was not statistically significant. They were not correlated. And something was found to be significantly higher. So it is okay. Not everything should come in positive correlation or statistical significance. Now this is what I'm talking about, the sample size. So sample size was calculated using this software and with the respective formula. Sometimes we mention only the formula. Okay, the sample size was calculated using this formula, that's it, and it came to 28. But a reviewer is expecting this statement, that you had preset the power of your study, or estimated or preset, assumed the power of the study to be 80%. Your beta error is so much, 1 minus beta error, and your alpha error, the level of probability, type 1 is alpha, beta is 2, is 0.05 with an effect size of 0.5. Effect sizes are also of 3 types. So 0.5 is a medium effect size. And after so much of presetting, this is not eligibility criteria also. This is the statistical sample size criteria. My sample size came to be 28. So, okay, so what they have done is pretty good. But they recruited 30 healthy volunteers because they had a fear of dropout. Sample size at 28, they took 30. Very nice. Okay. So, you must be understanding now by now that what are the things that we are missing. So finally, I would like to summate the presentation for today by just giving a name to these biases, which we have already, gone through the terminology. So these are just few biases which I have put here. There are many more. So selection bias, obviously, as I told you about subgrouping, randomization, recruitment, if you are not selecting it properly in the first place, this means you have committed a bias, and that is called as selection bias. It is a bias after all. Participants, I told you, vulnerable students and healthy participants. Sometimes, the participant, there is one more type of participant bias where the participant feels that, I should go in the other group. Why am I not in the other group? And the participant will convince the researcher, and the researcher gets convinced, and the group is changed. So this is a participant bias. You should not do this. You should not allow this. Sampling bias, as discussed earlier. Attrition and detection bias. So attrition is when you have trial arms. Trial arms is in, especially in a randomized controlled trial where you have 2 trial arms and 3 trial arms. So between groups, suppose if there are 2 groups, so one group you started in May 2020 and you finished data collection in December 2020. Okay, and you have to mention these things in the manuscript. Whereas the other group, the control group, maybe you started around May, but you did not finish by December. You took May to the other May 2021, almost a year. So when you compare between these 2 groups, the follow-up period or the time of data collection varies significantly. That is called as the attrition bias. So it should go hand in hand. It should finish almost near about together only, not maybe on the same data one. That's not necessary. Detection bias. Something that we never follow is blinding. Blinding can be, you can blind 3 people. So you can blind the assessor. So if I am assessing something, okay, the mastermind is someone else, maybe the guide, okay. I know I've been given this to assess A, B, and C. I will assess that. But I don't know what is happening in the other group. Or I don't know whether there is a second assessor and he's assessing X, Y, and Z on the same participants. This is called as blinding. Sometimes you do it in 2 groups. Sometimes you can do it on the same population. Sometimes the participants can be blinded because they don't know which group they are in. And one of the most easiest way to blind is, I mean, if you have, if you don't have enough assessors, what you can do is you can code the data. Coding the data is like, suppose, for example, if you have something in images, MRI images or X-ray images or blood reports or anything, you can just code patient 1, patient 2, and patient 3. This is also called as blinding. Okay, because if obviously, why do you need blinding is because if I know as a physiotherapist, intervention A is going to have an effect on, is going to have a better effect than intervention B, I might get biased and I know, arey ha, ye to itna hi aayega. So this statement itself is so biased. So this can be prevented when you have blinding. So I will do A, you do B. Okay. And statistical bias, P, phishing, when you are bypassing your hypothesis, something that you have set, objective kuch aur tha, hypothesis was this and this, and you're reporting something else only because you have applied wonderful statistical test over there, which is not needed, and that was not your intention in the beginning, and that is a statistical bias. Sample size will also come in statistical bias. Reporting bias, obviously outliers, when you make subgroups, when you fabricate data, when you present it in a different format. So obviously now just see, we won't be needing that sample. So the researcher is thinking and he throws it off. So outliers are, when your data is not, now you don't know whether your data is normally distributed or not, but when you look at the data, you feel that all the values are not central. They're not similar. One is coming here, one is very extreme. The values are very extreme. Okay. So then what you do, you remove the extreme values. and you just take the good values which you feel are in the, which look similar. So you can't do this. This is called as reporting bias. You report whatever you got. Okay, so there can be a funding bias. Sometimes not necessary just because your studies are funded, they will get published. In fact, you have a funding bias because these companies or sponsors who fund your projects, they might have a hidden objective. They might have, you don't know. So as long as the researchers, contributors stay clear of all these things, it is all good. But that is a bias. Publication bias, as I told you, publishing only positive results, and a researcher bias. So a researcher bias is, yes, I mean, when you start thinking, see, you are carrying out a research, but when you start thinking as a physiotherapist and not as a researcher, then that is a researcher bias. Because you think that in your experience, this was best, and I observed this in this particular patient. That is why A will only come better than B. I'm sure about this. So you can't have this perception. When you're carrying out a research, you are a researcher. You are not a physiotherapist. You are a researcher first, then you are a physiotherapist. By the way, these biases are all variants of confounders. We have heard about confounding variables and extraneous variables. Biases are one of the type of varieties of confounders. So I sincerely hope here I end my presentation, and I sincerely hope that I was able to change this perception. Over to you, Eden, if you have any questions for me.
Thank you so much, ma'am. I think so many of the points that you shared, especially regarding speaking to statisticians at the start, which I think is an excellent point, especially for students to consider. Because I think from the point where we start our research to when we finish it, we as individuals also have learned so much along the journey. And towards the end of it, we are more aware of things that we should have done at the start.
Exactly.
So I think it is very helpful for students who maybe.
And I have done these mistakes, and so now I feel so then you regret, wish you had done otherwise.
Yeah, and I think especially the examples that you use to help us understand errors, the choices that we make, I think it is very beneficial to be aware of these choices that we have as researchers. And the way you ended it, explaining that we are researchers first, and the kind of responsibility that comes with calling yourself a researcher, the kind of trust that is placed in you to accurately report, I think that is really something that will drive your motive of doing that research overall. I was just thinking of one question that was coming to mind, was that whenever we report any kind of errors or biases, what should the stance be? Should it necessarily be a defensive stance that, yes, there is this, but explaining why something has creeped into the study, or can it be more of just plain reporting, or does it have to come along with a justification for the choices that were made?
So I think, when you gave me 4 options, I think defensive and plain and with reasoning, and one more thing you said, I think it should be all. So because, and so see, now you are biased. You've become biased. So how should I do this? No, why should you be biased? I feel that you state your journey in the form of a story as it occurred.
Okay.
That's it. You state it as it occurred. This happened, I enrolled so many, few dropped out, few have, whatever other reasons, this happened, and I analyzed a subset only. Why did I analyze? What could be the possible causes of the bias? Now I feel that this could have been, this could have happened. So you are actually doing a reflective thinking. And you're telling someone else also, not someone else, you're telling so many people that this happened with me. And these are the results which I'm putting forth before you. So if you have a larger sample size, maybe you can try something else. Okay, just see how the results come out. So I think plain speaking also, defensive also, and all in all, report as it is.
I think
And
that is
trust me,
really,
this is going to help you, us in publishing in index journals. That's it.
I think this is a very important point, what you are saying about reporting as it is, because a lot of times I think we are in that mode of covering up. We want to hide things that now we are aware of, but I think putting it out there for readers to read, analyze, I think really helps all of us advance in our understanding of the field. Thank you so much.
Thank you so much.
With that, I think we come to the end of our session for today. I'd like to thank Physio TV for hosting the session and for Sancheti College of Physiotherapy for giving us this platform where we are continuously learning along with each other. I'd like to thank the technical team for their support today and especially our viewers who have joined us today. I hope that all of us will continue joining these sessions and will continue this journey of learning that we have started. So thank you so much.
Thank you. Thank you, everyone.
Just wait for 2 minutes.